Welcome to Gracefully Greying. I am your host, attorney Henry Gornbein. Today on Gracefully Greying, I am very pleased to welcome as our guests Dr. Joel Young, Margot Nash, and Jaime Saal as we discuss MindMetrix and the Rochester Center for Behavioral Medicine. First of all, Dr. Young, tell us a little bit about your background and the Rochester Center for Behavioral Medicine.
Well, thanks for having me, Henry. As you know, I've been a psychiatrist in the Metro Detroit area for now more than 35 years. I was trained at Wayne State and the University of Michigan. And I came back to Rochester Hills to set up the Rochester Center for Behavioral Medicine. We're an outpatient clinic, a mental health clinic. We have about 100 people now, and we take care of a lot of people throughout the region.
Next, Jaime, tell us a little bit about your background and your role with the Rochester Center for Behavioral Medicine.
Sure. Thank you, Henry. So I did my bachelor's degree at the University of Michigan in psychology and have my master's in counseling from Indiana University. And I started with the Rochester Center as a full-time therapist and then moved on to work as the executive director for many years, and most recently was promoted to the CEO role of RCBM, and I'm also the COO of MindMetrix, which we're excited to talk about today.
Margot, tell us about your background.
So I am the CEO of MindMetrix. I've spent really the past 15 years leading digital product teams and helping to bring new products, new tech products to life. I have my master's in industrial and organizational psychology, so I think that kind of led me towards choosing products and being really interested in products that help with assessment and with being able to predict certain outcomes. And so that's kind of how I've spent the last several years. And I'm really fortunate to have recently, over the past couple years, been connected with Dr. Young and Jaime.
First of all, Margot, what is MindMetrix?
MindMetrix is an online mental health assessment that can detect about 50 different mental health conditions. It was designed for consumers to be able to bring the results to a primary doctor or therapist or anybody who can help with their mental health treatment.
How did MindMetrix come into existence?
So about 2 years ago, a little over 2 years ago now, I got in touch with Dr. Young, who was interested in an idea that he and Jaime had been tossing around for a while. And I'll speak for you, Dr. Young, here. He really, the clinic, RCBM, had spent the past couple decades perfecting their intake process and their process for ensuring that their clinic had accurate diagnoses that were consistent across the board, across all clinicians, and that were really in depth and really looking at things that may have been missed in previous cases. I know from Dr. Young that his patients in most cases had previously been misdiagnosed before coming in. And he had this insight that folks today have a really hard time getting in to see a psychiatrist and specifically are getting treated for the most part by their primary care doctors. And he had said, I really think this process that we've built internally could be productized and made available for folks, so that they don't have to wait, so that they can get some answers and then bring those results to a doctor, whichever doctor they want, to help improve their care.
So is this done online?
It is. It's online. You can go to www.mindmetrix.com and get started and take the assessment. You actually take the first portion of the assessment for free, and it tells you if there are any significant symptom categories. And then if there are, you would pay about $99 for a full assessment.
Dr. Young, what age range is MindMetrix designed for?
Well, MindMetrix is designed at this point for ages 18 and above. So it's designed for people making the transition into adulthood, but it also takes us through those really crucial years of your third and fourth decade of life when so often anxiety and depression emerge. But what's also special about this product, particularly to the Gracefully Greying audience, is that this product is helpful to assess mental health conditions throughout life into the fifth, sixth, seventh, eighth decade. Henry, I'm actually a geriatric psychiatrist, and so I'm particularly interested in helping individuals in the later stages of their life. And what happens often is we have implicit bias. We will look at a 80-year-old, and without good testing, you can presuppose that they have certain diagnoses and not consider other things. Because MindMetrix looks at 50, maybe 52 different psychiatric conditions, everybody who starts the process at mindmetrix.com gets the answer, which is the truth, not what the bias of the doctor is, but it just will get you the truth because it is tireless in asking questions and getting results. And at the end of this process, the patient, the consumer, can take it to her doctor, and doctor can analyze it and then begin treatment. It need not be a psychiatrist. It's just your primary care doc. And the primary care docs really want material and objective data to make good decisions for their patient. And if you can bring this data to them, they're very, very content.
So, Dr. Young, to clarify, you've aroused my curiosity, and that is the MindMetrix assessments can be used as a tool for a primary care physician. They can be used as a tool for clinicians as part of the Rochester Center for Behavioral Medicine. So it has many uses, it sounds like.
We are committed to bringing good diagnostic, scientific care using the most recent guidelines really to the English-speaking world at this point. We do hope to get MindMetrix translated into other languages, but at this earlier point of our struggle to meet our objective, to bring good, objective support, to support practices, we feel that anybody who has access to a computer and goes to mindmetrix.com will have this. And sometimes people want it for their own edification. They want to understand themselves. It's a method of self-discovery. But very frequently, they want to take the next practical step and bring it to their doctor, particularly if they have concerns about anxiety, depression, ADHD, insomnia, obesity, eating disorders. If you bring the data to your doctor, she often can institute a plan. If she's not comfortable in the primary care setting, she always knows a specialist that she can refer you to. So this really helps your doctor be a better doctor for you.
Jaime, how is the MindMetrix assessment different from other mental health assessments that you might find on the internet? I mean, the problem is there's an overload of information and there's so many scams and so many things out there. How is this better and differentiated?
Yeah, so by and large, the assessment tools that are available on the internet are condition specific. So as Dr. Young mentioned, sometimes the doctors have a little bit of bias in which assessments they give their patients. The same could be said for the individual who's looking for the right test for them. If they feel a little depressed, they might just take a depression test and then say, I have depression. Whereas it could be bipolar disorder, it could be a root cause of insomnia. There could be a whole host of things going on together, and you're just going to get that one tiny piece of the puzzle. So MindMetrix, the comprehensive nature of it really allows us to understand the full picture of what the individual is experiencing. And then also, we haven't come across assessments that provide a comprehensive report like MindMetrix does that you can take and bring into that clinician that kind of shows all the tests that were given, all the conditions that were assessed for, the results of each, and kind of next steps that they can consider.
Dr. Young, you alluded to it, but let's go into a little more detail as to how MindMetrix might be of specific help to older adults such as myself?
Well, mental health conditions impact daily life, functioning, overall well-being, and they're very common disorders. For instance, anxiety can affect up to 20% of older adults. In some healthcare facilities or long-term facilities, 20% of the residents are depressed, feeling hopeless, unmotivated, really unable to participate or without enough energy or motivation to participate in their own care. We have insomnia in the older population gauged at 30 to 50%. And so those are maybe some of the more obvious diagnosis, but other things that could impact sleep are conditions like restless leg syndrome, which might affect 10 to 20% of the adult population. So it's been our objective, and Margot and Jaime have helped me fulfill this mission with MindMetrix, is to be able to deliver this instrument to individuals. They can participate, they can complete the process in about an hour, get a full report, and bring it to their doctor. And the doctors are so interested that I knew you had insomnia, but I didn't realize it was due to restless leg syndrome. Turns out there's a very good treatment for restless leg syndrome. Or I thought you were depressed, but I didn't realize that really what you have is attention deficit hyperactivity disorder. And the reason why you failed 3 or 4 antidepressants over the last 3 or 4 years is that your diagnosis is incorrect. MindMetrix actually brings the truth to the clinician. And what I found out about my clinician colleagues is they want to get it right. They just want enough data. And this is a way of bringing help to your doctor so she can help you.
Margot, you talked a little bit about that there are different layers of tests. How long is the initial test, first of all?
So the test, the first portion of the assessment, really, we're seeing it vary, but it can be anywhere from 15 minutes to a half hour. The whole assessment we're seeing take about an hour's time on average. And if you think about it, an hour is really pretty quick in comparison to what you would need to do if you're going into a clinic to get an assessment, or waiting even years to potentially get those same answers. The test really does vary in length depending on how many symptoms a person is having. It actually adapts to your responses. And so if it starts really broad, it casts a really wide net in the beginning, asking about symptoms, like kind of broad symptom categories to make sure that it doesn't miss anything. And then based on what's elevated, it kind of zeroes in as you go through and asks more questions about those specific symptoms to see how they manifest in your life. And the second portion of the assessment, go ahead.
Margot, you developed this, correct?
Correct. Well, with a team of software engineers and designers and experts from the Rochester Center.
So you've my curiosity has been piqued by the fact that over the years, as an attorney specializing in divorce and child custody, I've dealt with a lot of psychologists with the psychovals that are used in custody cases where they do various tests, including MMPI, Rorschach, etc. So are some of these tests involved with MindMetrix, or is this a whole different avenue that you're pursuing?
That's a great question. It is a different avenue. However, like those well-known tests that exist today, the second portion of the MindMetrix assessment incorporates these peer-reviewed, published rating scales that are out there. In many cases, we've licensed these, but they're tools that are well-known, well-respected in the field of psychiatry, and we bring them in and kind of selectively administer them depending on the first portion of the assessment. So there are tools that in many cases a clinician would recognize and be able to say, okay, no, a little bit about what this means. And what we do is, in a sophisticated way, incorporate a few of those tools for each mental health condition that is elevated so that we can paint a more clear picture of what's really going on. It's not going to be just one tool for insomnia. You're going to get a few different assessments to make sure that we can be accurate in what we're reporting in the end.
Margot, tell us what lies ahead for MindMetrix.
So you kind of alluded to this earlier, Henry, but we are right now really focused on individuals and helping folks be able to get access to the right kind of treatment. We are doing a lot of work right now to add new, less common mental health conditions to the battery, and we're kind of constantly working to improve what you're able to get as a result. But then what we're also really focused on as sort of a next phase is making the assessment available to practitioners and providers of various kinds, primary care folks, psychiatrists, because we know that the tools that we're offering are top-notch and really something that could help any clinician get better at measurement-based care is kind of a buzzword out there, but ensuring that they're using data to make the best decisions possible.
Margot, I'm thinking about the fact that earlier we talked about the fact that the diagnosis or MindMetrix helps with regard to diagnosis for anxiety, for sleep issues, for ADHD, ADD, for eating disorders.
Yeah.
What about things like dementia and Alzheimer's and some of the other illnesses that we suffer from, especially those of us who are aging?
Yeah.
So we want to move into cognitive assessments. And in fact, as recently as yesterday, we're recognizing that although we touch on that in the current version, that's definitely the next galaxy for us. And while we do that at Rochester Center for Behavioral Medicine, where we do incorporate MindMetrix, we also will use some other tools to help with cognitive assessment. So that's something that's part of the local Rochester Hills-based clinic, Rochester Center for Behavioral Medicine, but a full cognitive assessment is still on our to-do list, and we're moving forward with that with regard to MindMetrix. So I think that is key. One of the other comments I just want to expand on is that we have excellent treatments in psychiatry. They're very, very good. I've been doing this for 3 decades, and the treatments get better and sharper every year. It's very rare if I see a patient with ADHD or anxiety or depression or insomnia or substance use disorder. I am confident we now have the tools, both medications and psychotherapeutic, to help people. The key thing is identifying. That's where we're weak. When you have a tool that tirelessly identifies 1, 2, 3, what the conditions that you're struggling are, and MindMetrix will ask questions that are sometimes hard to ask. It will ask, because it's a computer, it will ask, do you have suicidal ideations? It might ask about sexuality, which is sometimes hard to ask about in the first time that you've met somebody. It is tireless and will ask in a discreet way and allow the clinician to have a full 3-dimensional perspective of her patients so she can make a really good treatment decision.
Dr. Young, tell us about any new developments going on at the Center for Behavioral Medicine, the Rochester Center.
Thank you, Henry. This has been in our 30th year. When I left the University of Michigan, I came back to Rochester and started with me, and we now have about 100 individuals, psychiatrists, psychiatric nurse practitioners, counselors, physician assistants, PhD psychologists, and therapists. So we take care of Michigan. We take care of the mental health needs of people in our state. because we are now telehealth due to some of the incredible work of Jaime Saal, who quickly got us into telehealth. We now are able to take care of people throughout the state of Michigan, from Monroe to Marquette. And we are very actively engaged in seeing hundreds of patients every week using newest medications, because we do clinical trials. So we always are up to date with new medications. We have treatments, novel treatments for treatment of resistant depression, for chronic fatigue syndrome, for eating disorders, for women's health issues. So we have specialists in all the above. And by exploiting telehealth, we really have been able to reach out to a lot more people, a lot more zip codes than we did before COVID.
Jaime, tell us how telemedicine, telehealth has impacted upon your practice, as well as the Rochester Center for Behavioral Medicine.
Yeah, as Dr. Young said, it's been incredibly gratifying to be able to help individuals across the state of Michigan, and particularly to serve some of the underserved parts of the state. So that's really been wonderful. And it also allows us to maintain appointments with our patients who are sometimes struggling, even if they don't have childcare or their clinician doesn't, or if there's inclement weather, illness. We can keep those appointments on the schedule, which sometimes are a lifeline for people. So that's really been wonderful, both for our clinicians, our staff, as well as our patients.
Dr. Young, what are some of the positives about telemedicine from your perspective?
You know, when COVID hit, we were entirely an in-office practice. And then we realized when we couldn't buy Lysol and couldn't keep the counters clean, we had to do something real quick. And overnight, we bought about 75 Zoom licenses. And we transitioned like it was a military operation. The first month or two, I thought, how good is this compared to in-office treatment? And now, several years into it, I'm quite convinced that for many things, it's superior. For instance, there's total confidentiality. There's no waiting in a waiting room. So if you are a high-profile politician, or the family doctor down the street, or the high school principal, you didn't want to go into a waiting room and see people. Now you need not. So it enhances confidentiality. Also, if you want to see us, but you're confined to a nursing home facility and someone can't take you on a snowy March day, that's no problem. If you're in San Diego spending the winter and you still need to see us, no problem. So on almost every level, we find it better connected. If you have a virus, if you have a runny nose, or we do, it doesn't need to impede the appointment. If there's construction on Livernois Road and you can't get to our office when they break up the street, you can still get to us via Zoom. And it also allows us to see inside someone's home, and so in some ways we feel that we can understand our patients better. I would say at the end of this process, I think there are still things to be said for inpatient, in-office appointments, but by and large, the many attributes of Zoom have made me convinced that this is the proper way to go.
Are there any negatives from your perspective? I mean, I'm just wondering, I mean, it's great. I love being able to do everything. I mean, in law, it's become a virtual world as well. But what about the loss of perhaps being in the same room, perhaps watching certain physical tells or quirks that you might not notice over a Zoom screen?
Yeah, there is something to be said about being in your visual range and being able to reach out and maybe examine if necessary. But much of what I do as a psychiatrist, I think I can do the proper examinations on the phone, or on the video screen, if I want to see movement or impact on muscle tone or gait. I can actually have my patient walk, or I can do neurological examinations, many of them visually. And we still have our clinic. in Rochester. And if we need to see somebody for whatever reason, we can just make the next appointment in person. But by and large, it gives people flexibility and access. And that's key. We spent many years as a country talking about access to mental health issues. And overnight, we solved so many of the problems because all you need is an instrument and you're there.
Before we sign off, Margot, do you have any final thoughts that you would like to share with us?
Well, just thank you for having us and letting us share what we've been working on. We're so passionate and excited about getting this out to the world. We really hope that this is something, that MindMetrix is something that can help make a difference for folks and actually help people get to the right answers more quickly. So thank you for letting us share.
It's wonderful, and thank you for being our guest on Gracefully Greying. Jaime, is there anything you want to say before we sign off?
Yeah, I guess I just want to underscore that MindMetrix's goal, as we've said, is to support clinicians, never to take clinicians out of the mix. We feel that having that clinician, giving them the data to support them in treating their patients is the best way that we can help. So MindMetrix is not a diagnostic tool, but it is designed to help the clinician and the patient.
Dr. Young, your final thoughts before we end the show.
Well, again, Henry, thank you for having me. You know, when you and Lori Bloom started Gracefully Greying several years ago, I was one of the early backers of this. And when preparing for today's interview, I went back to look at the Gracefully Greying website, and I'm amazed at how deep and rich you and Lori have built this site to be. It's such a great resource for this group of people. I'm glad and honored to come on again and talk about this new product, MindMetrix, because it really does serve the population that we're both interested in, which are adults and adults who are aging. And everyone needs access for mental health. It is the single most important part of quality of life, your physical health and your mental health, and there are great treatments. What MindMetrix allows people to do is get a good idea of what's struggling with them, what they're struggling with, bring it to your doctor, and there are really good treatments out there in 2024.
We're out of time. I want to thank our guests for participating, especially the Rochester Center for Behavioral Medicine, who have been one of our earliest sponsors. And I want to thank our viewers and, of course, Bloomfield Cablevision. Thank you again for this broadcast of Gracefully Greying.